you very much. Hi, good evening, and thank you for all of you who braved the cold weather to come out and join us tonight. As she just said, this is our panel presentation on Take Charge of Your Future, Prepare for Your Healthcare Needs. To start, I'd personally like to thank the Mark Twain Library for so graciously hosting this event, and a special thank you to Elaine Sanders and Maggie McIntyre from the library staff who worked with us on marketing this presentation and helping to spread the word to the community. I'd also like to thank each panelist for taking their time out of their very busy schedules and family lives to be here tonight to share their expertise with us. The format for an hour-long program this evening is as follows. Each panelist will briefly introduce themselves and let us know what they do. If you can kindly hold your questions until the end, we'll leave about 10 to 15 minutes at the very end for all your questions. We have planned to end this program at 8 p.m. Depending on the questions posed tonight, it may be appropriate for several of our panelists to answer. Tonight we have 4 panelists, each of whom have spent years not only in their respective fields, but also have invested time working with clients and families. The future is full of possibilities, and being proactive about your healthcare is one of the most empowering steps you can take to ensure a healthier and happier life. As the healthcare systems grow more complex, it is essential to understand your options, plan ahead, and take control of decisions that impact your well-being. Whether it's choosing the right insurance plan, creating a roadmap for aging, or building a network of trusted providers, preparation is key to navigating the journey with confidence. In this presentation, we'll explore practical strategies to help you prepare for your healthcare needs, as well as understanding the importance of planning for potential challenges. By taking charge now, you can protect your health, safeguard your financial future, and create a plan that aligns with your personal values and goals. Let's move into our panelist introductions, and we'll start with Anne McGuire.
Hi, everyone. Thank you so much for coming, and for all of you out there and at your homes or wherever. My name is Anne McGuire. I'm the founder and owner of Healthcare Pathfinder. We're a health and long-term care advice, advocacy, and management firm. I have a nursing background, and I'm also a certified case manager, but our primary focus is really helping people find, understand, manage, and advocate for their health and long-term care insurance benefits. Pass it to Pat. Pat Kenny.
Hi, welcome all of you. I'm Pat Kenny. I work with Provatus, and Provatus is a private care company. We are a medical model licensed private care company providing both nurses and home health aides. My background is in gerontology. I have a degree in gerontology and have worked as a social worker for a long time before working for a private care company. So it's a pleasure to be here to be a broader resource to you in whatever areas might be helpful.
Good evening, everyone, and thank you again for coming. My name is Florisa Zighini. I am a social worker. I'm an aging life care manager, or also called geriatric care manager. I have had the business for the last 17 years, and I do live in Reading. I'm local. I'm also a volunteer here at the library. So geriatric care management company, it's basically, I help family members navigate the challenges of caring for the elderly people. I have a particular interest in working with people living with dementia, assisting family members in how to care for them, how to speak with them, and a resource in a variety of ways to managing them. And a lot of times, people that are facing difficult issues, behaviors, and they just don't know how to speak with them and what to do next. So that's who I am. And I provide services here in Connecticut as well as Westchester.
I am Attorney Ann Cruz. I'm a certified elder law attorney and partner at Cohen & Wolf. And tonight we're talking about, my role will be talking about, again, resources, talking about the important documents, talking to the individuals and their own planning, talking to families regarding their loved ones' needs. That's what I'll be addressing. And as a team, this is a great team because we all kind of blend together and we all help each other to kind of the spoke in the wheel. The client is the spoke, and we are just kind of the hubs that all are surrounding the client.
Could you all speak up just a little bit? Just a little.
Yes, I apologize, I tend to be a little soft-spoken as the elder law attorney, so forgive me.
My mom was hard of hearing, so I'm actually trying to stop talking so loud.
Okay, so we're gonna start with a client story, which will involve all of our panelists in some way. Is this loud enough, or am I, okay. So Sybil Smith, who lives in Florida, has reached out to Ann Fowler Cruz, the attorney, for her mother Lily. Lily, who lives in Redding, Connecticut, has been admitted to Danbury Hospital due to a fall. Sybil does not think that Lily has any legal documents, and her Medicare Advantage plan is denying her stay in the hospital any longer. Sybil feels that Lily will need help at home, but she is very resistant. She will need someone to manage this situation. Fortunately, Lily has long-term care insurance, but Sybil doesn't know where the policy is or what it even covers. She's so overwhelmed with all the moving pieces, and she wants to know where to get help. So the first question I have is, what documents does Lily need to have to make it easier for her children?
So if Lily has capacity, then certainly what I recommend for everyone, I had my 18-year-old daughter signing these documents when she became of legal age. First one is going to be your healthcare instructions, healthcare proxy, healthcare representative. Basically, it's who's going to be making your medical decisions for you when you are alive but not capable of making your own decisions. And that decision really is the doctor's decision whether or not you have capacity to make those medical decisions. The doctor will then toggle onto your agent. So again, having the dialogue about who the agent should be is a huge part of my practice. I would say to Lily, we're not picking the oldest child, right? Because it's the oldest child. Look at skill set. Who has the skill set for that healthcare decision making? The pit bull, the advocate. The second document would be the power of attorney, which is again a document that appoints an agent to handle your financial affairs while you're alive, but sick, tired, too weak, not feeling well, or not competent. So again, think about the skill set for that role as power of attorney. And then the third and fourth may be a will, right? The will simply is a document upon your death, who's in charge, the executor, and where do your assets go? And then sometimes we talk about a trust as a will substitute and where that may or may not fit into the planning. If Lily doesn't have capacity, it doesn't have those documents, then we are stuck with a conservatorship or a guardianship in other states like New York. And that's a court-involved process. Lots of money, lots of time, and not really a pleasant scenario. So hopefully Lily has these documents in place.
Okay, does anyone else have anything to add about important documents?
Nope, I think she covered it.
All right, great.
Tie it in later.
Okay. Does Lily need to update her documents if these documents were created in another state?
Right. So I guess in a perfect world, do my little air quotes, right? We may want to update them. Power of attorney is a creature of statute, so it's going to have lots of language about either Connecticut or Florida statutes. Healthcare, I think doctors and health providers are thrilled to have any document in place. It doesn't matter what state typically it's coming from. And wills are honored in all, full faith and credit in all states. That being said, the Florida will is going to be governed by Florida law in Connecticut. So it can become a little cumbersome and awkward. So bottom line is the documents are valid, but should be updated. Just to make things smoother and easier for our family. That's really what these documents do, is kind of a gift to our family members to make life a little easier when you're not able to make these decisions.
And what happens if Lily,
And what about the healthcare proxies, as far as updating
I
those?
think we're okay. Most of them, healthcare proxy in New York, healthcare representative, I think doctors, I've never had a problem going cross states with it. Again, if you can't update them all, you might as well. I even have people having dual, Florida ones and Connecticut ones. Again, whatever we can do to make it easier for the doctors, easier for the financial institutions. Again, we can even do powers of attorney for all the individual brokerage houses. So statutorily, the banks are supposed to take powers of attorney, but brokerage houses don't necessarily have to by law. We hope that they will, and sometimes they do, but we get a lot of pushback from financial institutions or brokerage houses. So the other way to skin that cat, so to speak, is to get the Merrill Lynch power of attorney. What are they gonna say no to that? Most likely not, right? So you can bootstrap it, have that global power of attorney, and then the individual brokerage houses' powers of attorney. I gotta be careful, we're naming the same agents, but it's something to think about.
That's a great idea, because I had that with my father when he had a stroke and we were up in Maine. And this was not all buttoned up, and we were using the fax machine at the hospital with the bank, getting my mom's signature on whatever the documents were at the time. But it's something to really think about, that's set up, because it adds so much more stress when you're dealing with a sudden illness or situation, to have everything buttoned up.
Yeah. I mean, and just having the document in place is huge. I think that's 95% of the battle. But the other 5% is, when does it become effective, or how do you activate it, right? Clients ask that question, how do I activate the power of attorney? Well, you have to bring it to the bank. You have to bring it to someone, or, fax it to someone, scan it to them. They have to send it to their legal department to make sure it's valid under their regulations. And then you have to sign a signature card. So that whole kind of, getting it up and running is not always something you do the day you sign the power of attorney. So I have a power of attorney to my daughter, but she better not be using it, right? It's there just in case. So if she's not getting a signature card, she's not getting on my accounts, it's in the go-to spot, right? If something happens to mom, you gotta go to that spot, that's where it is. So we always are gonna have that little piece, but I think as we age, there's a certain time where you say, I'm gonna put my kid on a power of attorney now, it's okay, right? So that's a question of when.
Well, it reminds me too, to make sure that your loved ones know where those documents are, because you can have them done and somebody can't find them, so let somebody know. Our next question is, what happens if Lily runs out of money? How does she or her family pay for care?
Well, that's always a question that a lot of clients will eventually come to me with and ask, now what do we do? Long-term care insurance is fabulous if we have it. With the VA, there's lots of patchwork sources of payment for home care, nursing home, assisted living, so we want to tap into all of those. And then of course the kind of the safety net in our country is going to be, or is currently, Medicaid, which does have eligibility requirements, but it also has spousal protections. So there's always that safety net. Medicare does not typically cover a lot of these long-term care. I'm looking down the pike because all these ladies know this and we'll probably talk about it, right? So, Medicare is only a Band-Aid for acute care. Then what? So we have to look to sources of payment for long-term care.
Okay. Lily has other children, and if the children don't get along, how can she choose her agents?
Oh, this is where I spend so much time with my clients about picking the right agents, okay? You really have to pick the people that you trust. They're gonna be making decisions for you. This is about you when you're alive and in a weakened state, who's gonna be in charge. So I really talk about, do you wanna make two people powers of attorney? I think the answer most likely is no. Because if they don't get along, and I have this story right now, live, where the two daughters are powers of attorney and they're not agreeing. They're not agreeing. And if it's severally, or even if it's jointly, what happens? So to some degree, you just pick one, one healthcare, one power of attorney. Hey, listen, life's not perfect. These documents aren't perfect. That's why having these conversations with our family members early on are so critical, because if the kids don't get along, they're never gonna get along. And as mom or dad needs care, those family issues just kind of bubble up, so we really have to think about it. So maybe it's not the family members, right? I go to the tiers of our circle of influence. Maybe it's siblings, cousins, neighbors, friends. Maybe it's professionals that are step into the position of care managing, of powers of attorney, trust companies for handling the finances. So we have lots of options that need to be explored, and that's why having those conversations about the family dynamics is huge.
Okay, great. So why is her Medicare Advantage Advantage plan denying her stay in the hospital?
I'm sorry, I can't hear you.
Why is her Medicare Advantage plan denying her stay in the hospital, and what can be done to resolve this situation?
Well, there could be a lot of reasons. So in the situation, and you may have all heard about Medicare Advantage, which is a form of Medicare. So, but it's, what it is, it's managed Medicare, where everything's packaged together. It's sort of, if you have your old or the type of group insurance I have, it's all packaged together with your medical and your prescription drug coverage. And the original Medicare, it separates this out. But the big difference with Medicare Advantage is that the insurance companies are managing the care. That's why it's called managed Medicare. Under original Medicare, it's really more managed by the hospitals or the physicians and determining when the benefits are end or when, what the discharge plan is going to be. So in this case, Medicare Advantage, they make the determination as to how long she stays in the hospital and what is going to be the discharge plan, that they approve it. They sort of, with conversations with the doctors and the hospital team. But in this case, they may be saying, she's been in the hospital long enough and it's time for her to go home. Or they may be saying, we're gonna deny her to go to rehab or something of that sort. So kind of gonna make it up in this story as far as they want her to go home. So if the family doesn't agree with this, if they feel that Lily still needs to be in the hospital, maybe she still has a fever and they're kind of saying she should go home, you can appeal that. But the important things to do as a family, when this comes up with a family member or friend, is to talk to the care managers. They're the ones who give the notice that the benefits are ending. And then you have conversations with the care manager and your doctor to say what's going on, what is the reason, what's going to be the discharge plan, should we appeal it? They may or may not agree with that. But then you can determine, do you appeal it? And what happens in that case is they sort of halt, like she can continue to stay in the hospital, but there's a 2-day turnaround for Medicare to make a determination as to yes or no, she can stay, we can approve it. Ideally, you like to avoid getting to the point where it's an appeal, where you're having ongoing conversations and planning that discharge to home. But in this case, if it is approved, then great, then you can work on the discharge plan and figure out what's next. And I could do a whole presentation about this. There's so many different pathways that can go here. And actually, we all could be brought in on this conversation as far as in different, talking to care managers at the hospital. They're the key point people to talk to. But with the Medicare Advantage, what is important about this, and we do this several times a year or multiple times a year, is when you're in the hospital, it's an opportunity to actually switch off of the Medicare Advantage plan. If they're not happy with this, if they decide that they don't want the Medicare Advantage plan determining what the care is going to be going down the line, they can go back to original Medicare and get a prescription drug plan as well. But it will not happen until the first day of the next month. So it could be, and actually we've changed clients who literally, it's Sunday the 31st, and we're taking them off the Medicare Advantage plan, and original Medicare becomes effective the next day. So that's sort of the key point on that. So how that's going to impact what happens with Lily, it depends on what it sounds like she's gonna go home. So then you have to determine how you're going to work with the insurance company on the discharge plan with Medicare Advantage. Is that good?
Yeah, you kind of answered a little bit on the next question. How could someone avoid this type of situation in the future? And what are opportunities for someone to change their insurance?
Okay, so I did answer some of the questions, but the opportunities is to really be thinking about the coverage that you have now. And if you do have a Medicare Advantage plan now, you're still in a window, an open enrollment period, if you will, to change back to original Medicare. You can switch off of your Medicare Advantage plan or switch to another Medicare Advantage plan or switch to original Medicare. So that's through till the end of March that this can happen. So you've got 3 months. This is sort of the open enrollment period for Medicare Advantage. So that's,
I'm sorry, I'm not following. Why would you change back if you have the Advantage plan?
if you're finding that the benefits are not right for you.
Right.
So that's why you could switch off of the Medicare Advantage and go to the original Medicare. For some people, it's the plan is not right for them. They may be in an HMO type of restricted plan. Their doctors aren't in network, or the rehab that they want to go to is not in network.
What happens if you could go to any doctor that's in your plan, that's in or out of the plan?
That's for you. You can stay in that plan if you're happy with it.
Yeah.
Yeah.
Okay.
It's just what people experience sometimes when they're in the hospital. It's more restrictive. And when you're in a rehab, the Medicare Advantage plans, they're much more proactive in managing your care and the discharge planning side of things.
Okay, thank you.
I do have one question. If you do switch off to the regular Medicare, do you have to pick up a
Supplemental.
the other
A supplement with the,
Yeah.
and yeah,
You do that at the same time?
yes,
Okay.
yes. Now, I'm talking about the state of Connecticut and state of New York. In other states like Florida, going off the Medicare Advantage plan, you may not qualify for a supplement plan. They can deny you for pre-existing conditions. So when we're talking about states that you can change onto a supplement plan, you can change your supplement plan without having any pre-existing conditions, then you're fine. But thank you for your question, because that's really very important, because we've had situations where a client literally switched off of the Medicare Advantage plan knowing she could not get a supplement plan down in Florida because the doctors weren't in network. They wouldn't accept her. So she said, I will pay that balance that the supplement picks up, but I'm not staying on this plan anymore.
Got it, thank you.
Yeah,
And they would have to get the prescription plan as well,
a
right?
prescription
Okay.
drug plan. If it was
If they're
included with the Medicare Advantage
Right.
plan. Right, yeah, but you are eligible to, that's the only, you can't just change your prescription drug plan during this period. This is for Medicare Advantage plan that I'm talking about, or during the year when you're in a hospital situation where you have an opportunity to change. So it is confusing. What you should take from this is that there are opportunities to change, and it's called special enrollment periods. So if you're in a situation where you're feeling like this isn't right, just be thinking that there's something maybe I can do here, and talk to case managers at the hospital, or talk to, professional advisors. We all know that people can change plans.
Just for clarity, a Medicare supplement plan supplements original Medicare.
Correct.
And when you say that the Advantage plans are more proactive, I don't think you mean they're necessarily proactive in the interest of the patient.
Yes.
Just wanted to make sure that I got that right.
Yes. People have different
I mean,
opinions.
proactive sounds positive.
Well,
I think
people
in this
have different
case-
opinions on it. I worked for a managed Medicare product, I should say, many, many years ago, and it was much more collaborative. Now it's very much more, insurance company is making decision versus
Yeah.
the insurance company collaborating with the
thought,
team,
yeah.
with the team at the hospital. Yes, yes. So if you ask providers, what they would prefer is they would prefer to work with patients who have original Medicare. But original Medicare doesn't come with all of some of the benefits that Medicare Advantage plans provide. So, and the cost, it's a big difference in cost in those benefits. So you really have to balance it out. You have to see what's right for you, as far as for many reasons.
Would it be right to say that the cost of original Medicare and the supplemental plan tends to be higher in cost than the Medicare Advantage?
Definitely.
Okay.
You can have a zero premium, but you still have your Medicare Part B. Everyone has to pay that, yeah. But definitely, it's, you've got deductibles, you've got co-pays, it's just a little different experience from even that standpoint. But that, again, that could be a whole presentation in itself, talking about original Medicare and Medicare Advantage.
Clarissa,
If I can just add, I think, and I say this to some of my clients, if you're a healthy person and you don't need to see a lot of doctors, it's good to be on Medicare Advantage plan. If you see multiple doctors, I think it's best to be on traditional Medicare, because Medicare Advantage plan, they dictate how long you get to stay in the hospital, what facilities you should go to, because not all facilities will take Medicare Advantage plan. So just be aware of that. And same with doctors. I just got a call last week, a gentleman who his wife is very sick, and she is on United Healthcare, and the concierge doctors that the wife is using, they go to her house and they live in Pound Ridge. So Northern Westchester Hospital is providing the care, and they send the concierge doctors to the house, and now they've been told that United Healthcare will no longer be a provider for these doctors, so he has to switch, and he's trying to find ways, because his wife is not able to go to the doctor anymore. So, and it's a very hard place to get to in Pound Ridge, so he's in this dilemma. And so I suggested to him, I actually gave him Ann's name, and also suggested switching to a traditional Medicare. So I don't know what happened there, but just be mindful of that.
Okay, since Lily has long-term care insurance, how does Sybil know if Lily qualifies for it? And how does this impact her discharge plan and future care needs?
Oh, right, you get to hear from me again. So, long-term care insurance, it can be great if you have it, especially so many people who are older at this point, have very old plans that have incredible benefits. And I understand, again, this is a conversation about, a cost and affordability, because long-term care insurance is very, it's expensive, the premiums, if you're not using it. But when you do have the opportunity to use it, Lily would probably qualify if she needs assistance with at least 2 or 3, depends on the policy, activities of daily living. And this Pat and Florissa, we're all experts in this side, which is bathing, dressing, this is
Transferring.
assistance, or depends on the policy, assistance with bathing and dressing, toileting, transferring, eating is being fed, not having someone prepare your foods. That's one side of qualifying. The other one would be dementia or cognitive impairment. So should qualify based on those criteria, and the insurance company would determine that. They would make an assessment. Jenny, is there?
And then how does that impact her discharge plan and future care needs?
So it impacts it in a big way, and Pat could even chime in on this, because the long-term care insurance, depending on the policy, they often have a sort of a deductible, an elimination period, so they do have to pay out of pocket. But it's going to pay for home health aides and some other, depending again on the policy, but home health aides, it'll pay for that, which Medicare does not cover for ongoing private care. And that's custodial care. So years ago, Medicare used to provide a lot of those benefits. When I was a home care nurse, like almost 30 years ago, 8 hours a day, 5 days a week, we would have aides in there. That does not happen at all anymore under Medicare. So that's why there's Pat's company is one of the agencies that provides these services, and they bill to long-term care insurance or people pay it privately. So in Lily's case, it would really be a benefit, and many of the long-term care insurance policies have care coordination benefits. So they'll pay for someone like Florisa to be a care manager. And that's where we maximize access to these benefits for people who have those long-term care insurance policies, to make sure that they know how to activate the claim and from a cost-effective way, really use those benefits and extend them as long as they can.
And I just want to add something to that. So with the care coordination, when it's written on the long-term care policy, there's no elimination period for a person, myself, to go in and do an assessment and make certain recommendations. They will pay, the family will get reimbursed immediately if they file the claim.
If they qualify.
If they qualify, yes, if it's in the policy.
Yes, yes.
Because not all policy includes care coordination.
So care coordination means that Florisa would come in and she would come into the hospital and meet Lily. And I may refer and say, you need Florisa, you need a care manager to come in and help with the discharge planning and work with the care managers. Or Pat may come in, depending, Pat may have been already contacted by the care manager at the hospital for home care services. So Pat will know that she's got long-term care insurance, and then she'll start sort of coordinating with everyone as far as who can help support the services there.
I think it's such a good example of how we work as a team. I mean, we're not actually a team, but we know each other and we know where to access great assistance with people who are exactly the right person to meet the need. So the discharge planner, the care manager in the hospital, is somebody who is employed by the hospital, very, really great resource within the hospital, but super busy people, so the amount of time they're going to be able to dedicate to the specifics of your care needs or your loved one's care needs is just limited by its nature. And most situations are not simple. You come into the hospital with a whole bunch of issues, right? And so to be able to, if the hospital says somebody needs home care and they call me in, it's always very clear to me when a client could benefit from more than what I do. So somebody might need a private aide, they might need a private nurse, and I can help them with that. But when somebody has complex psychosocial needs, when they have family that isn't local, or family that's super taxed and busy, to bring somebody in like Florisa, who can come in and do that, go into the home as well as coming into the hospital and do those thorough assessments, is just going to bring it to the next level in terms of planning. And you don't have that much time. So it's really great for you to be here, tuck it away in the corner of your mind so that when you run into these situations, or you're, like to do that pre-planning, to bring somebody in proactively, because that's always the question, right? Do we wait until an emergency, or do we act, proactively.
That's why planning in advance is the key. Like Pat said, in this case, in this story, the patient is ready to be discharged. And mind you, in the hospital, you may think you're not ready. You're not emotionally and physically ready to go home. There's no one there at home. And once the doctor and the case manager in the hospital tells you, you're gonna be ready to be discharged tomorrow, and they call Pat, because the first thing they're gonna say, well, she needs help, so they're gonna call a home care agency. And Pat will try to do whatever she can, but the family member who lives far away in this story, who doesn't live locally, is now gonna be scrambling, like, what am I gonna do? So the home care agency will then direct the family member to contact either an attorney or a geriatric care manager. And all those things is gonna have to be taken care of by the family members, because the care manager in the hospital will not have the time to be there and handhold you and walk you throughout the whole process. Their goal is to get you out of there, because time is money for them. They don't care about anything else, unfortunately. So having all the resources that you're hearing here today is gonna help you to plan for the future.
You kind of already started the next question is, how does someone know they need an aging life care professional, and what do you do as a professional or geriatric care manager? You kind of tapped on that a little bit.
Okay, so yes, not a lot of people has heard about geriatric care manager or aging life care managers. Basically, we're social workers or nurses or therapists, physical therapists or occupational therapists who does this on the side. And basically what we do is we help seniors and their children navigate the healthcare system. And in my case, in this story, being that, if a loved one lives out of state, it's another set of eyes that, to get a geriatric care manager to help their loved one navigate the system where they live. So I could be the set of eyes in making sure that mom is taken care of. If a home care agency was put in place at home, monitoring the services that the person is providing, making sure that they're eating well, they're getting their medications, they're getting the exercises that they're supposed to have. As a geriatric care manager, I try to maximize all the services that the person should be getting at home. So getting in a visiting nurse service that's covered under Medicare, hiring a home care agency that can provide the hands-on care that the person needs. So it's great to have that in your pocket.
Just also as a aging life care member as well, what's wonderful is there are resources all over the country where there's associations that are, if you have family members who live in different places, you can go on to these websites. It's the Aging Life Care Association, there's Case Management Society of America, and you can look up and based on zip code find care managers in that area. But the other thing I do recommend people do in finding aging life care specialists, or all ages, I deal with clients all ages, is talking to the primary care physician and asking if they have a relationship with a care manager, or do they have a relationship with a home care agency. I try to get local so that you can really sort of try to have a team that's local. And that's where hiring, with the daughter living in Florida, it's having someone like Florisa come in is finding local. So I think that's just very important if you're especially got family members elsewhere.
How else do you assist family caregivers, Larissa? How do you assist family caregivers?
So basically, I help them with just coordinating the care. I could be the person, if they have doctor's appointment, coordinating their doctor's appointments and making sure that they get to their appointments, making sure that they're complying with their medications. During my visit, I would, help them with that. And just, I am the key person, basically, that will communicate everything that's happening within that household to the family members, so reporting to them to make sure that everything is in place. And sometimes if a client is in need of assistance in even paying their bills, so now the daughter lives out of state and mom's been handling everything at home and now they're sick, and I'm seeing piles and piles of papers, and if the daughter from out of state has not taken care of the bills or put everything in bill pay, I would make recommendations for them to hire a daily money manager, or depending what their needs are, it could be an accountant, an attorney, financial advisor. So I'm the person that can direct them to all the key players that can help the patient.
And that's as well with Medicaid planning as well. And Medicaid planning should be, and you can sort of respond to this, but it really is more state specific. So it is, unless attorneys are familiar with other states applying for those benefits, there's different qualifications and different, it's nice to have someone local. So again, it's calling human service departments, it's calling aging life care professionals who will know who the contacts are for services like that.
So if someone wants to look into a home care agency, what's the difference between hiring a caregiver privately and working with a private home care company?
That's for Pat.
Yes.
So I think when you consider those two options, it might be that, Lily's daughter knows of somebody's neighbor who was great and they say you should hire Sally, we liked her a lot. So then the thing to think about is, are you prepared to be the employer? Because if you are, then hiring somebody privately may make sense. There are advantages to that. The advantage would be you don't have to abide by the constraints that a home care company has in what a caregiver can and can't do, like administering medication, and there are other constraints that, when you're hiring a private care company, you need to abide by. So there are those pros. The big question is, do I want to be an employer? And if you do, then there are things, and I actually printed out some of them because I wanted to be sure, and Anne could certainly speak to this better, but just some of the things that you would need to think about if you're hiring a private aide directly is you're responsible for the taxes, Social Security, Medicare, unemployment, the background checks and the vetting. So, you have to take care of those on your own. Those are things that a company would do. The lack of backup care. So that's a really important one. So you have this awesome primary caregiver who has a family emergency and needs to leave, or they're away on vacation, or whatever it is, who's going to be who's going to fill in. Liability insurance is very important. If they're injured on your property, then you bear responsibility, and it can impact the estate as well as you personally.
And then you're calling Anne Fowler Cruz to help clean up the mess.
You're also needing to manage any potential disagreements there might be, between Lily and the aide, or if there are more than one caregiver between them. So I think when you think about the cost, the cost difference, it may well be less expensive to hire a private aide than it is to go through a company, but there's a cost to all these things as well. So those are the things that you wanna think about.
And maybe talk about the positive side of having an agency and what you do as far as being an agency.
Yeah, so my role as liaison is to be the first point of contact, with somebody. So when a family member calls or one of my colleagues or the hospital calls, I'll go and assess that person in the hospital, wherever they are, and be a resource to you in terms of coming up with a plan, because that is not a small deal. And whether it's Provatus or another private care company, you're hiring a team, and every company is going to be a little different in the structure, but you have people that do the hiring and people that do the scheduling and the coordinating. So if somebody calls out, then you have somebody that can replace that caregiver. They're pre-planning for a snowstorm so that they know that the person is in place, and those emergent kind of things. The company that I work for is a licensed private care company, which means we have nurses that oversee the caregivers as well, and they're available as a resource. So when you're talking to private care companies, you want to ask those questions about, the kind of oversight they have and the ability to do that fill-in when there is when somebody calls out. So I would say, and so you're paying the cost, the extra cost of private care is so that you have a team that's expert in all of these things, and that you don't have to become the expert in trying to coordinate that on top of having a loved one who's got care needs.
I just want to add something too with the licensed home care agency. And I say this because there are multiple agencies out there, so be careful. With the licensed home care agency, they do with providers, they have nurses that will check in unannounced to make sure that the care is being provided. So there's also other home care agencies out there. There's the registry home care. Well, that's like having the private, there's just so many home care agencies. So just be very careful. And so having a licensed home care agency is great because they do go and check in on they're vetted and they check in on their clients, which is good.
And the background checks are very important.
It's important.
And so we have, there's a background check at the time you employ somebody, but you also want to have ongoing background checks should something come up in the course of when they're employed. So anyway, as Anne said, this could be a whole long conversation, but we can leave it at that.
And then one more thing that I just thought of, if you have long-term care policy, most long-term care policy will only pay if it's a licensed home care agency, not a self-employed home care.
Well, with the point with that is
Yes.
that if you do have a long-term care insurance policy, before you hire people and start working with them, you should really make sure you understand how that policy works and what type of services it will cover.
Right.
Because we've had clients hire private people, and then they remember they have the long-term care, or they want to activate the claim, and they realize that aid is not going to be covered by the policy.
So I have two questions, both of them are financial. The complaints I have heard on the long-term care is that when people need it, they alert them, I need it, and there's that window where they're saying, well, you have to wait a certain number of days, which most people have no idea that's.
It's usually a 90-day elimination
90
period.
days, which is, you could easily be dead.
Yeah, exactly. That's what they're hoping.
That's what they're hoping. So I mean, we're sort of being awfully sanguine and positive about all this, but I mean, it is it is money-making, and so it's just there. My other question is on what is the daily cost, to the family to help Lily?
Okay, so just on the elimination period, so that's an out-of-pocket time. So it's not that you can't access care, it's that it's not gonna be paid for by the long-term care insurance company.
Well, but that's like, yeah.
Yeah,
Yeah.
I know, I'm
It's
not
the same thing.
negating, I'm not negating it, I'm
Right.
just saying, but
Just
yes,
clarifying.
yeah, yeah. Yes.
But some, and again, I'll just to that, some policies, and it depends on the type of benefit, is 1 day equals 7 days.
Right.
So you have to make sure the people read their policies, and some policies have benefits that actually you can start care, and there's no elimination period for home care services. They waive the elimination period as long as they have a care manager involved assessing and creating a plan. So it depends on the policy. I have so many clients that are getting a ton of money from their long-term care insurance policies. So I
Well, they
know
paid
there's-
in a ton of money too.
Exactly,
Yes.
yes.
Yes, let's be clear.
Yes, no, I'm just
Yes.
saying, I just want people who have them to understand that,
Yeah.
Now, Pat,
Yeah, so that ties into the next question, which is, it depends on the plan. So,
what if someone doesn't have a plan?
well, so with Lily, to go back to her, the question would be, what does she need at home, right? So, if she's had a fall, chances are, so what I would do when I go in to talk with Lily and her family is to say, what kind of supports do you have at home? So we're looking at what informal supports there are, is there family there, and where are the holes that need to be filled in? And then when Anne was mentioning earlier about activities of daily living, I'm gonna be asking about those. A key one is, will Lily need help going to the bathroom? So if she does need help going to the bathroom, then she needs a lot of care because it's an intermittent need, right? She might need help during the night as well as during the day. So again, we're looking at who's there to support her, where are the holes, and how much help does she need? So let's say, so in terms of the cost of Provatus, we're kind of in the, I'd say the mid-range of private care costs, it's $40 an hour. So I'd say that it's probably mid to high right now, I'd say. So you probably could get private care from 30, again, non-medical companies are going to be less expensive.
36 to 45,
Yeah.
that's like the range.
And how about for a live-in?
So a live-in caregiver is $425 a day. And a live-in caregiver is living in the home. They'd have their own bedroom. They would have downtime, 8 hours of downtime at night. And they would be providing, about 13 hours of care during the day. And so it depends on, on what the specific care needs are.
And keep in mind the average cost of a nursing home, anyone wanna guess?
Okay.
13,000 a month.
It's about 18,000 now. In Westchester, it's $22,000 a month.
Just where we don't wanna be.
Correct.
Exactly
right.
The Center for Medicare Advocacy, does that fit in with what you're?
Yes,
asking
I
us
call
to
them
do?
all the time.
They're wonderful.
So we have about 5 more minutes, so we're supposed to wrap it up. So the last question for Pat is, if Lily's very resistant to accepting help, how do we convince her?
Yeah, and so I think the key word is not trying to convince her. Yeah, I think the challenge that we often get into when we have we are the adult children, or we become the child of adult children, or you know what I mean, that dynamic shifts, and it's not a great one. So I think what we need to really remember is to be respectful and collaborative with the person needing help. versus trying to convince them. And so, having said that, it's difficult. It can be really challenging. So I think those are the conversations I'm having both with the family and with the client. And we want to talk about safety now, what I consider safe, right, versus what the client might consider safe are two different things. So you're weighing all that. You're weighing cognition. If somebody's able to make a reasoned decision, I might disagree with their decision, but if they're competent, then they have the right to make a decision that I, as a family member or a professional, might disagree with. And so I would say in terms of if Lily's really resisting, I want to engage her in the conversation. I want to know why she's resisting. She's probably heard a lot of bad stories from a lot of family or a lot of people about, who haven't had great experiences because it's mixed. And you have a stranger coming into your home, you're giving up your autonomy. I mean, it's mostly really hard. It's a bitter pill that most people don't want to swallow, and understandably so. So I get it. I'll be in the camp of people resisting. But
Can I just, the thought with that, and if you're dealing with your family member with wanting to bring someone in, what I always recommend is use your visiting nurses, bring in an external person, talk to your the primary care physician, have them initiate the conversations, have the attorney, really the doctor assessing competence, so that you're not making those decisions. They're able to sort of say, this is what you need to do, or they can ask them.
And I think also to just lessen the impact of saying you need to do this, I think just changing our words in a much gentle way and just say, can we try it? Let's try it. And I say that because I have dealt with a lot of clients who resisted, kicked everybody out. And just changing the approach made such a huge difference. And, I think it's worth trying. You try it, and if it doesn't work, let's reevaluate. And I think, like what Pat said, including them in the decision making and finding out what's important to them. Why are they resisting? So I think we forget that they're also a person and we need to listen to what they want. Yes.
Can I ask you a question in a new area, or you want to cover?
Well, I was gonna open the floor. I was gonna let them just quickly recommend their 3 top tips that they would recommend for a potential client in relation to their industry, and then we'll open the floor to questions, okay? So I'll start with Anna. Wyatt.
Well, mine are very simple, is understand your insurance, know what you have, and understand what your coverage is, so that you're not caught off guard. Be proactive, and in asking questions and getting second opinions and talking to professionals. Don't do it on your own. So many people are going through what we're all going through. And have an advocate. Having an advocate is the most important thing. If you can't advocate for yourself, think of who that person is now.
I would say to do what you're doing right now. Get as much information as you can in advance of a crisis, so that you're well prepared. And you're going to forget a lot of it, so just put it in a file. And what stands out for you now, take it. Do those action steps and just bullet. What was actionable about the conversation tonight. I would say when you have caregivers in your home, you need to let people know what's important to you, because I think of it from a caregiver's point of view. They walk into a stranger's home. We all think that the way we run our home is just the way a home is supposed to be run, but we all do it differently, right? So you need to tell them what's important to you, so that they know, because they want, caregivers are an incredible breed, everyone's not perfect, but that they go in and do this job, they wanna make you happy. So let them know how to do that, let them know where you need space, and, when you need a break from them, you need your privacy, tell them where to be so that you know how to get them when you need them, but you also can have as normal a life as you wanna have.
Okay, so for me, I think it's important to have the conversation. Start having that conversation with your loved one. And as we're aging, we also need to tell our children what's important to us. And I think just start planting the seed, and then find out, like I said, find out what's important to them. Where do they want to be as they grow old? Do they want to stay at home? Do they want to be in a facility? Do they want to be closer to where you live? So just starting those conversations, I think it's important. And then finding out, you okay? God bless you. And just having to know who their doctors, their accountants, their attorneys, having all those information is key. And if they have passwords, have them start writing things down and have them put it in a place where you can find them.
For me, it's communicate, and I think we've all kind of said it. Communicate in writing, right? Get your documents in place now. Communicate in soft notes. I want to be buried, I want to be cremated, I want a huge party, whatever it is, write it down. Because sometimes our kids aren't going to listen to us, they don't want to hear about it, right? So write it down. Have those conversations. They're hard, but in the end, they're very good. My mom pre-wrote her obituary. Thought it was the strangest thing ever. It was a gift. It was truly a gift. So another form of communication, write it down. Knowledge is power. Gather this information, keep it in one spot. I think Pat, you said the same thing. And then the last thing is your go-to spot. Where's your go-to spot, okay? Where is the family gonna go? If anyone knows me, I talk about getting hit by my bus. So if you get hit by the bus tomorrow, you gotta have a go-to spot, and that's gotta have your passwords, your information, your account, your financial advisors, everything you possibly can think about. Think about the bus tomorrow and start your to-go plan.
All right, that's it.